Well, good evening. How are you all doing? Good. Let's see, where to begin exactly? How many of you, when you picture your last day, I mean like your real last day, the end of your life, want to die of old age? Not a debilitating disease or an accident, but of old age, whatever old age means. So raise your hands. Y'all probably should have your hands up, right? Okay, put them up. Y'all want to die of old age, keep them up. I do too. That's how I want to go. Unfortunately, according to the CDC, our own Centers for Disease Control, us over here, we're the only ones that are going to die of old age. Nice. 70% of the people in the United States today are supposed to die from a diet-related illness. You guys work with public health folks in your own work and around the state and probably outside of the state. What I think has begun to change in this country that is beginning to have a very profound effect is some of these issues related to obesity, how many diet-related illnesses there are, whether it's diabetes or heart disease, changing patterns we're seeing in those things, health care and the crippling cost of health care. And you're seeing folks like our First Lady, Michelle Obama, draw attention to these issues with her Let's Move campaign. The United States Department of Agriculture with Kathleen Merrigan as the second in command and Tom Vilsack as the main secretary, folks who believe in these issues and know about them and are turning this huge monstrosity of the USDA just a little bit toward the direction that all of us work in. I was speaking to a cafeteria coordinator at a school up in the Northeast Kingdom, and she said that the only time when their school lunches do not meet the requirements, the nutritional requirements set out by the government, is when they are using only USDA commodity supplied ingredients. Now that seems crazy to me. In addition to some of those kinds of things, I don't know if anyone recently heard about the Too Fat to Fight report. 25% of military recruits are kicked out and told to slim up because they are not fit for military service because of being overweight or obese. 25%. Now, I don't know about you, but I've been looking for a long time on how to get some money out of the Department of Defense. I'm starting to think this might be a good way to do it. Not to have our young men and women be so fit that they can go off to wars, but I think we can squeeze a few billion out, don't you think? They got more than their share. The U.S. Department of Agriculture, by the way, is the second largest department after Defense. So we got them both now in the palm of our hand. Another report that just came out recently that is another example of a shift in thinking is Obama's Cancer Council report. Did you guys read that at all or see that? Okay, it's just a couple of days ago or a week ago maybe. One of the things in there that it talked about was how 6% of cancer deaths in this country are directly attributable to toxins in the environment. They expected that perhaps more would be also, but that was what they could really nail, that 6%. The primary source of those toxins was our food supply and our water supply. So their call to Obama, who set this council up, was to use his power and his influence to remove toxins from our environment, first from the food chain. They said things like grass-fed meats in there. I don't know if those words have been uttered before around this issue. They talked about local food systems in there. It's quite amazing. And so if you take all of these things together, what you're beginning to see shift in this country is not that people are necessarily connecting to it through sustainable agriculture, which for a lot of people is a pretty remote concept. Here in Vermont, we're surrounded by it all the time. We all drive past farms. We all shop in places where we see local produce and other products. So it's something that we live with. The rest of the country isn't like that so much, not nearly as much as it is here. But through this issue of our health and obesity, both economically and through our readiness, our military readiness, as well as many others, I think we're going to start to see some more resources flow into healthy food systems, access to fresh food, access to local food, and begin to see it hopefully through the school system. Michelle Obama, the First Lady, talks about trying to get rid of obesity in one generation. Not that the rest of us she's given up on, but that starting with kids now through the school system is a way to retrain eating habits. And for many kids in this country, especially in rural areas in Vermont, more than half of their calories come from the meals they have at school. I think in the Northeast Kingdom, it's between 50 and 70% of their calories in the day come from school meals. So in poorer regions, there are not other meals at home waiting for them when they get home from school. They are sent home in some cases with leftovers. They come for breakfast and then lunch again. And so that is a key way to tackle and to retrain some of these habits that we have all gotten into. There's also $15 billion, with a B, billion, in the healthcare bill that passed. That's for prevention. That has never happened before, as far as I know. That amount of money focused on that. Preventative healthcare has a lot to do with our diets as well as exercise. So there's another source. I'm almost thinking about the money. Where can we get the money to do what we all know we need to do already? So those are a few little pots that I've discovered recently that I'm awfully excited about. Okay, so we kind of got to this place somehow also. I just wanted to back up and do that a little for you too. I guess just briefly by way of introduction of me, I started saving seeds. I grew up gardening with my dad, who grew up in a farm school in California. But I started saving seeds when I was 19 and sharing them with people, put out a little seed catalog, and that's grown from this hobby to a smaller business to a little bit of a bigger business. And I'm fortunate to have a nice crew of extremely smart people at home doing all of the work so that I can spend part of my time out telling a story about what we do as a company and why it matters. But the whole purpose for me in starting Mowing Seeds was to help support the rebuilding of healthy food systems in Vermont and beyond. And to me, I'm very food system centric. You know those people that you talk to that always bring everything back to a certain topic and you get really tired of it after a while? That's me. And I think that you can solve, I think the food system causes most problems and can solve most problems. So I'm going to give you a little bit of historical perspective on that, and then love to hear some of your questions.